Let me give you some facts and some briefing material, and then we'll take whatever questions you have. Today is day 177. I know it feels like just yesterday that this started. Not really. Question is, when we get up in the morning, where are we with COVID on day 177, and what kind of progress are we making? And today is a great day. It is, the infection rate today is 0.66. That is the lowest infection rate that we have had since we started this. So that is really great news. And it's not just that the 0.66 as one day is great news. It's consistent with what we have been seeing all along. If you have been looking at our infection rate over the past couple of weeks, it has been below 1%. So it's not an anomaly, the 0.66. It's basically tracking what has been going on, which is we've been doing a great job keeping control of this virus. Congratulations to the people of New York. It wasn't rocket science. It just took the nation a long time to understand that we're dealing with a virus. It's a question of science, not politics. You can manage a virus, but you have to understand what you're dealing with. It's a virus. It's a function of medicine and science and biology, and you have to treat it that way. We made a mistake early on. We made a lot of mistakes early on. With this European virus. I call it the European virus. Some people call it the China virus. The virus did not come to New York from China. The federal government missed that. The virus came to New York from Europe. That's why it's the European virus. That's why if somebody knew what they were talking about, they would call it the European virus. When they say the China virus, which some people refer to it as, it actually makes the point of the mistake that the federal government made. They believed the virus was still in China. The virus was not in China. The virus had left China and gone to Europe and had come here from Europe, and they never knew that the virus left China. And that's why New York was ambushed. But we then had an issue in this country where we treated this as a political issue as opposed to a medical issue, as opposed to a public health issue. And that caused the virus to raise out of control in other parts of the country. That's not what happened in New York. New York was a pure ambush because we didn't know it was coming from Europe. But in New York, after the ambush, we treated it seriously, and we made a difference. The other numbers, 482 hospitalizations, 122 ICU patients, 54 intubations. The number of lives lost is 7 yesterday, and they and their families are in our thoughts and prayers. The 3-day rolling average is 5. If you look across the state, the numbers are good all across the state, with one exception, but you see Long Island over the past few days, 0.8, 0.7, 0.7, 0.8. Today, from yesterday, 0.6. It's true all across the New York City boroughs. Western New York, we have a caution flag, and we're focusing on it and trying to understand exactly what is happening. The number of positive tests is somewhat escalated. Not a cause for serious concern, but it is a caution flag, and we're looking at it. There have been several clusters in Western New York. There was a steel plant in Erie County, a food processing factory, 2 nursing homes, people coming in for hospital procedures. A number of them have tested positive. There's seasonal labor forces that come in for farms. But we do more testing in New York than any other state, so we can identify when you start to see an increase, a quote-unquote cluster, as we call it. That's very important, so you can then attack that cluster, and you can stop the spread at that cluster. So that's what we're looking at in Western New York.